The story you're about to hear is a typical one. 33-year-old Valerie Daniel does all the typical things a mom of two does. Also typical, Valerie, like 117 million Americans, suffers from a chronic illness. In her case, it's Crohn's disease, an inflammation of her GI tract.
When I have flare-ups and I'm really, really sick, I am confined to the bed a lot, either because of weakness or pain.
Now, like many Americans, Valerie does have employer-based insurance. She gets hers through her husband's employer. Every few weeks, Valerie makes the 40-minute drive to a hospital to get an infusion treatment. She invites me along on her next trip.
Another option with this type of medicine is a lifetime commitment.
But you couldn't not take the treatment.
I had no option. I mean, at this point, I had tried every drug, surgeries, procedures. This was my option.
Without insurance, a year's dosage could cost Valerie about $20,000.
Are you worried about the Affordable Care Act being repealed and the impact it would have?
I'm nervous, not knowing the future, not knowing exactly what's going to be voted on. What are they going to keep? What are they going to do for people like me?
First, the good news. Under the Republican-proposed American Health Care Act, here's what they're keeping. People like Valerie can't be discriminated against for having a pre-existing condition. There will still be a ban on lifetime and annual caps. And her kids can still stay on their parents' insurance plan until they're 26. But the downsides: employers with more than 50 employees no longer have to provide insurance, so getting covered through her husband's work may no longer be a given. And also, the new bill will incentivize all Americans to have continuous coverage. This is to prevent people from buying insurance only after they get sick or injured. But Valerie has experienced already just how difficult it is to keep healthcare insurance, especially if you're out of work.
My husband lost his job a few years ago, so there was about a 3-month period where he was not employed, and we were told that we had no choice. We had to pay for COBRA because of my pre-existing condition, that if there was even a little bit of a lapse of coverage, that then I would not be allowed to be covered.
Under the new bill, having a lapse in coverage of more than 63 days means that if you try and buy insurance on the individual market, you're going to have to pay an additional 30% tax on your premium if you try and enroll again for the remainder of the year. And it's not just the 63 days from the time you lose your job, but any time you have a gap in coverage of 63 days in the past year at the time of enrollment.
When you had to go to COBRA because your husband was not employed anymore, how much did that raise your premiums at that point?
The price of COBRA was over $900 a month. So we had no choice but to reach out to family to help pay for that.
Consider the fact that most people are unemployed for 10 weeks before they find a new job. That's 70 days. And when people are unemployed, just getting by, paying bills like their mortgage, can be difficult, let alone paying an insurance premium on top of all that.
When you look at our health insurance industry overall now, what grade would you give our health insurance system?
I would probably say about a C.
C.
Maybe a B minus.
Of course, she's really hoping that the final replacement plan will be an A grade for her and the rest of America. Dr. Sanjay, A grade for her and the rest of America. Dr. Sanjay Gupta, CNN, Atlanta.